public health thrives on our ability to protect and improve the well-being of entire communities. This is where population-based programs come in. These programs are designed to address the health needs of a specific group, whether it's a neighborhood, a city, or even an entire nation. Think of a program aimed at increasing vaccination rates among children, or perhaps an initiative to promote healthy eating habits to combat rising obesity rates. Creating a successful program requires more than just good intentions. It demands a well-structured research plan. This plan acts as a roadmap, guiding every step from identifying the problem to evaluating the program's impact. Key components include a thorough understanding of the issue, clear objectives, and a robust methodology for collecting and analyzing data. Before diving into a research plan, we need to understand the landscape of the problem we're tackling. This is where a literature review comes in. Think of it as detective work. You're combing through existing research, studies, and data to answer a few key questions. What do we already know about this health issue? What are the gaps in our knowledge? What have other programs tried, and what were the results? Let's say we're looking at smoking cessation programs for young adults. A literature review might reveal that while many programs exist, few effectively engage young women. This insight highlights a significant gap and an opportunity to develop a targeted program. With a solid understanding of the issue, we can now define the purpose of our program. This is a concise statement outlining the program's overall goal. Are we trying to prevent disease, promote healthy behaviors, or improve access to healthcare services? Let's stick with our smoking cessation example. Our purpose statement might be to reduce smoking rates among young adult women in urban areas. Next, we break down this overarching goal into specific, measurable aims. These are concrete objectives that, when achieved, demonstrate progress toward our overall purpose. For instance, one aim might be to increase the percentage of young women who report quitting smoking after participating in the program. Every good research plan needs a theoretical framework. This might sound intimidating, but it's simpler than it sounds. Essentially, a theoretical framework provides a lens through which we view and understand our problem and our approach to solving it. It draws upon existing theories and models from fields like psychology, sociology, or behavioral economics to explain why we expect our program to work. Let's imagine we're developing a program to increase physical activity among older adults. We might choose the social cognitive theory as our framework. This theory suggests that people's behaviors are influenced by their own beliefs, the actions of others, and their environment. Using this framework, our program might focus on building self-efficacy, creating social support networks, and making environmental changes to encourage physical activity. Let's look at the nuts and bolts, methods, and measurement. Now it's time to get specific about how we'll conduct our research. This is where the methods section comes in. First, we need to choose a study design. Will it be a randomized controlled trial considered the gold standard for evaluating program effectiveness? Or perhaps a quasi-experimental design, which is often more feasible in real-world settings. Next, we need to determine how we'll recruit our participants. This involves defining our target population and selecting a sampling method. For example, if we're studying the impact of a school-based nutrition program, our target population might be elementary school students from a particular district. We might use a random sampling method to select participating schools and students. Finally, we need to decide how we'll measure the program's impact. What data will we collect? What tools and instruments will we use? will we use surveys, interviews, or physiological measures? Often, we can leverage existing validated instruments. These are tools that have been tested and proven to accurately measure the concepts we're interested in. For instance, if we're measuring depression symptoms, we might use the widely validated Patient Health Questionnaire, or PHQ-9. Using validated instruments strengthens the rigor and credibility of our research. Now, let's bring it all together. Resources and implementation. No research plan is complete without considering the practical aspects of implementation. This includes outlining the resources needed to bring the program to life. First and foremost, we need to secure funding. This might involve applying for grants, seeking private investment, or leveraging existing resources within our organization. We'll also need to assemble a skilled team, including researchers, program staff, and potentially community health workers. Finally, we need to develop a realistic timeline for each phase of the research, from planning and data collection to analysis and dissemination of findings. A well-structured timeline keeps the project on track and ensures that resources are used efficiently. Creating a population-based program is a significant endeavor, but the impact it can have on the health of a community is immeasurable. By carefully considering each component of the research plan, we can develop effective, evidence-based programs that truly make a difference.